This lecture is a discussion of the utilization of human subjects in research. We are covering the topic from Chapter 9 of our Shamu and Resnick textbook. This is the last lecture in Module 3. I'm going to do a couple of things before switching over to the PowerPoint presentation. First, I'm going to go to the document camera to show you some documents from a high school student's research project. Although that individual did not use human subjects, I was able to capture his forms and use them to present to you today to make the point that for animal use, biosafety, for cell culture, and for human the utilization of humans as research subjects, the compliance rules and regulations are pervasive, regardless of who is doing the research. So let's switch over to the document camera, and we'll take a quick peek at these papers. This is for the Intel Science Talent Search. It is a national one, and for any of the students submitting a research project for this beforehand in their local competitions, they would have to have had this type of approval, but they have to document it or seek approval again through the process required by the Intel Science Talent Search. So this is the Institutional Review Board IRB approval form for projects involving the human subjects, and you can see some of the questions. Institution providing approval, explain why the human subjects are proposed, necessary for the project, describe and assess the potential risk, physical, psychological, social, legal, or other, describe procedures to be followed, and attach a sample of the completed informed consent form. And we see that provided. Here. An informed consent form, so the student researcher's name, high school, the research title, research procedures involving you, because you're providing this to the research subjects, to accrue subjects, risks, possible discomfort, so on and so forth, procedures to be used at minimized risk, possible benefits you may reasonably expect. If you have any questions regarding the project, contact a supervising professor. In this case, of course, that's for the students. Participant signature, guardian, supervising scientist signature, and so on and so forth. So they're quite extensive and virtually identical to anything that would be used at any research in any research setting at any research institution. And again, describe the procedures, describe benefits to the individual or society. Remember our discussion of the utilitarian theory being instrumental in scientific research. Explain how the benefits exceed the risks, and then the approved by the IRB, as shown there, scientist and science teacher are involved, physician, psychiatrist, physician's assistant, licensed psychologist, registered nurse, licensed social workers also can be involved, school administrator, so many levels of documentation and verification of appropriate approval. Included are guidelines for evaluating the risks in activity and research groups, so different research groups and activities are described here. We notice invasion of privacy or breach of confidentiality. So there are many principles that are essential in this type of an evaluation. Now I come back to the computer. Before I proceed, I'm just going to set, no, I'm not going to set my arrow because I have to escape this to go to the UTSA website. And what I'm going to do is find the IRB at UTSA. So under research, we go to the Research Development Office, and we see this listed here, at least at the time of recording this in November of 2005. This is the location. Human research subjects, so there are other links here to guide you in understanding the procedure. There's a link at the bottom for the NIH Office of Human Subjects Research, NIH IRB training module, Office for Human Research Protections of the Department of Human Health Services, the Belmont Report, and the Code of Federal Regulations that oversee this compliant activity. And then there are forms that can be downloaded here for the scientists to complete their IRB protocol. So now let's go to our lecture. I will now set my arrow and review the information provided by the authors in the chapter. So the overview is we'll talk a bit about the history of human research, comment on the ethical dilemmas and principles going back to our original studies in this course on basic concepts, principles, and theories, ethics codes, ethics regulations, the IRB, and we now have a little bit of an understanding of that, at least the universality of that as a requirement, protecting vulnerable subjects, and then misconduct in clinical research and trials. So the human experimentation before World War II included some of Hippocrates' work. The conservative approach of the scientific revolution is significant. There are key events, maybe milestones even, in the 19th century, the 20th century. A major milestone, of course, is the first case of documentation of informed consent in research by a U.S. Army physician, Dr. Walter Reed. Before World War II, many of the subjects were from vulnerable populations, children, mentally ill people, prisoners, and minorities. So obviously this is not the case now, and we'll follow the historical perspective and then discuss the requirements and regulations. In 1900, Prussia was the first nation in the world to formalize the prohibition of medical interventions other than for therapeutic purposes. So any type of invasive procedure is considered serious unless it is directed at therapeutic goals. The eugenics movement in the early 1900s obviously are an astonishing period of events, and we'll discuss them just briefly. So most of Hippocrates' work was based on observation, so there were no controlled experiments for obtaining the knowledge as we understand it to be gained from empirical scientific approaches. Later, the Hippocrates School of Medicine laid down a code of ethics that was instrumental in promoting the welfare of the individual patient. And we all know that there's a Hippocratic oath that is modified considerably for physicians, MDs, and DOs, osteopathic physicians, to swear to that oath at the time of graduation. Of course, there are other codes of ethics that really are more practical and enforceable, but that as a historical value is sustained. During the scientific revolution, people like Paracelsus, Andreas Vesalius, and William Harvey developed new experimental methods and questioned the validity of the old way of research. So very early on, there was questioning about what was ethical and what was not ethical. Humans were being used as subjects for research with or without their consent. So this was one of the major issues in the ethical consideration of such research. How can you perform research on subjects when they don't know that it is occurring? In the 19th century, for example, a bullet wound in the stomach was treated by William Beaumont for a patient named Alexis St. Martin. The healing process for that left a hole, a patency, through the abdominal wall on the outside all the way into the patient's stomach. And the Beaumont later hired that individual as a research subject to observe the process of digestion. So employing an individual as a research subject. So this is a very interesting aspect, using a financial or economic basis as the source of benefit to the candidate subjects in the research project. We know that people can be paid for participating, so there's some resolution of that. You're not an employee, but you are remunerated as a component of the direct benefit to you. Other benefits may be uncertain. The 19th century, for example, 1874 is one of the most disturbing instances where a 30-year-old feeble-minded patient was treated by Robert Bartholomew, of course without representation as a proctor, someone having the authority to make the decisions for the feeble-minded patient. He inserted electrodes into the brain of a patient who was dying of terminal cancer. So obviously we're understanding that that line of reasoning was used by the scientists in the attempts to justify the acts. Without the patient's knowledge, Giuseppe Senarilli injected yellow fever bacteria into 5 human subjects to test its virulence. As an outcome of this, another milestone is noted in that William Osler wrote The Principles and Practice of Medicine, so we're beginning to get evidence of codification and instruction in the practice of research types of medicine. And in this publication, Osler condemned that work, especially that of Senarilli. So progressions toward bringing or publicizing, bringing to the attention of the general public the questionable ethics and the starting to focus on the responsibilities not only of the scientists but of the profession and of society and no doubt government to oversee the protection of the human rights and ethical practice in such research settings. In the 20th century, for example, the germ theory was proposed by Louis Pasteur, obviously a tremendous milestone in science and medicine. And Robert Koch found widespread, this idea of the germ theory found widespread acceptance. However, in review of their approaches and their studies, the ethical practices were questionable. So again, what we're dealing with is the history of the generation of scientific and medical knowledge, much of which is still being utilized today. And we know that the one exception is the work that we'll discuss under the Nazi reign in Germany, where it is socially and I believe even legally unacceptable to utilize any of that data to make any contribution to science and medicine. So the antiseptics saw their emergence, so there was tremendous benefit, good, this universality of utilitarianism, that we have come to understand as a positive outcome of this. So they were developed and tested by surgeon Joseph Lister. Another milestone in the 20th century, the methodology of conducting research on human subjects was changed, and it was done with their consent as a standard after they signed a contract with the U.S. Army physician Walter Reed for yellow fever experiments. They proved that the disease, of course, was transmitted by a mosquito, and I'm going to try to pronounce that. But it's not such a clean record. This idea evolved as liabilities, accountabilities, and responsibilities emerged in some of these tests throughout the process of putting them all together and completing them. I think this should be 20th century, not 10th century. Sorry about that. Another milestone of the 20th century, Claude Bernard, a famous physiology researcher, restated the principle of the Hippocratic Oath, cause no harm. So there should be a principle coming to your mind immediately, the principle of non-maleficence. We recall how that interplayed with the principle of beneficence and other principles that we had mentioned. The respect for autonomy in individuals, that has to do, of course, with the informed consent and the right to say no, to deny certain aspects of utilization of themselves in healthcare, therapy, and research, of course. And then justice. Distributive justice is a major one, and then justice, for protecting rights is another type of a justice. So the introduction to the study of experimental medicine in 1957 was a publication by Claude Bernard. I think it's quite obvious as I point out milestones. These would be key points for me to focus on when generating questions for the quizzes covering these lectures. Just a bit of a tip there, of course. So before World War II, the subjects chosen were primarily children, mentally ill people, and minorities. The prohibition of medical intervention was legalized in Prussia in the 1900s, as we said, and any medical intervention is to be done only for therapeutic purposes, and obviously this was not honored, and definitely eugenics became a popular concept, and there were strict orders to sterilize people who were mentally insane. I'm not saying this was not honored in all cases, but in many cases it still wasn't. So we just had not had the uniformity of acceptance and implementation and requirement, i.e. federal regulations, of a uniform approach to this, to protect the innocent and to protect the human subjects in the research. So Hitler advocated eugenics, as we all know, and felt that the Aryan population should not be corrupted by the inferior races, and performed many atrocities, several of which were in the context of medical and scientific research under conditions that we now, of course, know and knew at that time are absolutely unacceptable. So the Nazi experiments conducted on the human beings stand out as clearly the worst experiments ever performed on human subjects. The hypothermia studies, decompression, wound healing, vaccination, and infection studies, Mengel's human endurance experiments, and his twin studies. Of course, we know that the Jews, Russians, Polish were chosen for the research in nearly every instance. They did studies on under extreme conditions without any attention to the pain and suffering of the patients, and we know that that is absolutely unacceptable. Intense moral controversy and blatant disregard for the moral status of these individuals. They were considered not to have a moral equivalency to the Aryans, and therefore are treated simply as animals in that sense. A set of codes for dictating human ethics termed the Nuremberg Code was a positive outcome from this and established a worldwide standard and a set of regulations from which penalties could be administered. So that was in 1949. The code did not put an end to the human abuse in research, however, but it did create a standard. So there were controversial cases subsequent to that, even like the Tuskegee, Willowbrook, and a Jewish chronic disease case study. The period of the Tuskegee syphilis study was from 1932 to 1972 in a public health clinic. The goal of the study was to follow the natural course and symptoms of later stage syphilis in African American men, even through the time point when an antibiotic treatment was known, it was not utilized. In addition, of course, they weren't even told what they were suffering from. There was some basically untruth that was provided to them to explain some of their symptoms. The Willowbrook hepatitis experiments began a long-range study of viral hepatitis in an institution for mentally retarded children. In the Jewish chronic disease case study, Brooklyn, New York, 1964, researchers introduced live cancer cells into unsuspecting patients. So there were controversies, too, in social sciences research, as the researchers could influence the phenomena and thereby the response of the subjects. So there were several episodes of human abuse in research, even subsequent to the Nuremberg Code. So during the Cold War era, the human radiation experiments took place in the United States from 1944 to 1974. At Vanderbilt University, researchers gave pregnant women radioactive iron to study the effects of radiation on fetal development in the late 1940s. And these are just unquestionably outrageous in terms of worldwide society today. Not that they weren't then, it probably didn't come to the attention of society at that time. So the safeguard wasn't in place. The policing by the profession, by the professionals themselves, just didn't exist. And this is, of course, why we're in this course today, because I believe this is a much better approach for a unified effort to increase the awareness of each individual, especially people trained in science, to be responsible themselves and compliant. African American men were subjected to abuse in Oregon State Prison from 63 to 71. The researchers x-rayed the testicles of 67 male prisoners to study the effects of radiation on sperm function. So these are quite horrible, might not be quite in the category of pain and suffering and total disrespect for the individuals as moral entities, but the data is used from the studies we just described in the continued development of scientific knowledge and medical practice. So a lot of washout studies were conducted on mentally ill. This is a protocol where they discontinue the intake and measure how long it takes for the body to completely remove or obviously wash out the medication or any of its metabolites from the system. Obviously, in mentally ill patients, this means the recurrence of the symptoms, which is definitely a significant level of suffering, if not pain as well, depending upon the mental illness itself. Some mental illnesses involve self-inflicted pain, suicide, and so on and so forth. So remember, non-maleficence as a principle here playing a key role, and non-maleficence was the principle that, when invoked, also invoked the laws and the types of penalties that can be imposed under the legal system, as well as the ethical system. Ethical dilemmas and principles, then. It's important to use human subjects in research in order to gain scientific and medical knowledge, but this also places people at risk and may violate their dignity and rights. So remember the ethical dilemma, good and bad together. Something needs to be done, but it can't be done without the good and the bad of things. So to focus questions about risks and benefits, the U.S. uses the minimal risk concept. The probability and magnitude of harm and discomfort anticipated in the research should not be greater than ordinarily encountered in daily life or during the performance of a routine medical exam. The benefits for the subject include access to new treatments and increased knowledge of their health and body. The costs for the subject include possible serious deleterious effects. So these are major concerns in the ethical dilemma arena on this topic. The ethical codes that emerge, the following principles govern the ethics of human experimentation. So the informed consent, respect for persons, beneficence, social value, justice, protection of vulnerable subjects, scientific validity, and data monitoring. There's one that is not showing up on this list, but certainly is implicit from the list and explicit within these two, and that is confidentiality. The principle of confidentiality is essential in the utilization of human subjects in research. The two main, and again, along with the confidentiality, we have harm, potential risk of harm, non-maleficence, invoke non-maleficence, and so on and so forth as we described. So the two main codes are the Nuremberg Code that we mentioned and a Helsinki Declaration in 1964. We're hearing at this time in the fall of 2005, the Helsinki Declaration and other types of international codes for the treatment, the humane treatment of captured prisoners in war. So there's a lot of reports in the public media discussing what might be going on or what might have happened, and questioning the ethical practice even under conditions of war, where there can be certain levels of exception, as in pain and suffering and discomfort. So these matters don't leave us at any time throughout history, present, past, and certainly future. So the ethics regulations then. In 1953, NIH opened an intramural research operation called Clinical Center. The National Research Act of 1974 required each research institution to review and pass judgment on the acceptability of the proposed research according to the detailed requirements listed in the regulations. In 1979, the National Commission for the Protection of Human Subjects of Biomedical Research issued the Belmont Report. We saw that posted, a link to that posted on the UTSA website, Research and Development website, for our IRB. In 1991, the Common Rule, a final federal policy, was issued, but many government agencies did not adopt it. So it is an intense social matter that progresses slowly. From the perspective of scientists, it certainly adds a tremendous amount of administrative and bureaucratic workload and feelings that it's an undue burden on the efforts to achieve the good of research. And therefore we see these struggles to balance, get something new put in place, but people just don't quite accept it. So it's a very complex and controversial matter, as you certainly understand yourself. Now then, the institutional review boards, or IRBs, institutional review boards ask the following questions when considering a proposal. Is it research? Is it human subjects research? Does the research require IRB approval? Does it require full IRB review? Are risks minimized? Are the risks justified in relation to the benefits? Ever see the benefits versus risks, or good versus harm? Always on the balance. Is the selection of subjects equitable? How will subjects be recruited? Is confidentiality protected? Remember I said this would become explicit. Is informed consent required? Does informed consent need to be documented? And is the informed consent adequate? So obviously there's qualifiers under each of these criteria questions, and absolute standards must be met. Are any safeguards required to protect vulnerable subjects? Is the protocol scientifically valid? How will the data be monitored to protect subjects from risks and ensure the validity of the results? Are there, in other words, controlling for bias, is it a double-blinded study? And what risks might be incurred by having a substantiated double-blind study? Are there any conflicts of interest? Are there any collaborating institutions? So a wide series of questions, each of which must be asked, deliberated, investigated, and confirmed as being more than adequately and sufficiently responded to in the content of the proposal and the entire project. Therefore, we can transition to a discussion of protecting vulnerable subjects. We saw that implicitly and actually explicitly in the series of questions asked by the IRB. So for mentally disabled research subjects, IRBs that review protocols for research on such subjects should include at least 2 members familiar with the particular disorders and with the needs and concerns of the population being studied. Therefore, informed consent and risk for harm and potential benefit can be substantially assessed, professionally assessed as well, with expertise. For research protocols with greater than minimal risk, IRBs should require independent, qualified professionals to assess the potential subject's decision-making ability. So might they need representation, and just how ethical is it under such conditions to proceed with the proposal as stated in the request. For children, the federal regulations require IRBs to classify a research proposal on children into one of 4 categories: minimal risk research, greater than minimal risk research with the prospect of direct medical benefit to the child, greater than minimal risk with no prospect of direct medical benefits to the child, greater than minor increase over minimal risk with no prospect of indirect medical benefits to the child. So from our training now, our studies in basic concepts of ethics and morality, we see embedded within here many principles and theories and approaches in ethics and morality in general. And it's always this weighing, this balance of benefit and risk. What we should also be seeing in here intuitively from our studies is consequentialism, but more so the altruistic type of consequentialism, non-egoistic, altruistic consequentialism, as you recall, was utilitarianism. And utilitarianism uses utility as a primary principle and beneficence as another primary and substantial principle in its practice. So regardless of what you might think is your standing theory of ethics and morality, in research you must implement utilitarianism. The same comes out when you look at the protocol for utilizing animals as research subjects. Next then, with prisoners, the research this is much more restricted now than it ever was before. The research protocols may involve prisoners only if research is of minimal risk related to the causes or effects of incarceration. So it's constrained to the imprisonment and its related conditions and situations. The study is of the prison and inmates as an institution, more of a social or psychological type of study. The research is on conditions of prisoners as a class, and the research is therapeutic with potential benefits directly to the prisoner subject. And then finally, a few comments on misconduct in clinical research and clinical trials. We know these are also pervasive. We don't have to look too far into our recent past to find significant numbers of cases of misconduct in clinical research and clinical trials. So the guidelines require that any investigation into misconduct in clinical research and trials should follow these elements. So these are our guidelines when we are ethically moved to act under conditions of suspected, alleged misconduct or substantiated misconduct. Coordination of human subject protections with the IRB, informing physicians and patients when significant public health issues are involved, informing the Data and Safety Monitoring Board, informing the affected journals, and then coordination of the investigation with the Office for Human Research Protection. So there are systematic approaches to bringing suspicious cases to the attention of the appropriate individuals, governing bodies, and procedures for following through to investigate and prove or disprove the allegation, and then consequences as an outcome, and of course the imposition of penalties at the appropriate level for the extent of the infraction of the compliance regulations. So this completes our discussion on this topic. I appreciate your time and attention and look forward to seeing you again soon.